Has a hidden blockage been quietly draining your energy? Gentlemen, let's have an honest chat about something every man notices after hitting 50. It's the big issue nobody talks about openly, yet everyone wonders about in private. Your strength, endurance, and that calm inner confidence that comes from knowing your body will respond when it should. Maybe you felt things are a bit slower now. Perhaps the firmness isn't what it once was. You might even be dealing with unexpected urinary hiccups, or that persistent lower back pain has gotten worse. Like most men, you may have simply accepted this as the unavoidable cost of aging. But what if I told you the decline you're facing isn't a life sentence written by Father Time? What if the real problem isn't your age, but a simple mechanical blockage in your core that you've overlooked for years? I'm talking about a precise, powerful pressure point in your body. A therapeutic hotspot that, when stimulated for just 60 seconds a day, can unlock that blockage and reset your system. Picture boosting blood flow to your entire pelvic area, giving the tissue responsible for firmness all the circulation it needs. Picture relieving the key nerves that control sensation and performance, bringing back that noticeable spark of youthful sensitivity. Picture easing deep, chronic tension in your core muscles, reducing stiffness not just in the bedroom, but in your lower back and hips too. I know, it almost sounds too easy to believe. You might be doubtful, thinking this is just another health trend. But hear me out. This exact spot, which we'll find together, has been celebrated in traditional medicine for thousands of years as the center of male energy and vitality. And now, modern neurology and physical therapy are confirming why this method is so effective. I'll take you through a full step-by-step guide. I'll show you the precise location of this potent point, sometimes called the million-dollar point. The exact 60-second massage that delivers maximum blood flow and nerve benefits. And the top natural oils that transform this simple massage into a powerful treatment for inflammation and vascular health. This isn't about depending on anyone else. It's about taking control of your own body. No expensive tools, no awkward doctor visits, just 1 minute of your day. This easy practice might be the missing link in your routine that brings back comfort, freedom, and confidence. Before we get into the deeper anatomy details, I have a quick favor to ask. If you're serious about discovering natural, proactive ways to improve your health, hit that like button right now. It helps this important message reach more men who really need it. And leave a comment below. Share the single biggest myth about male aging that you want to bust. Let's start the conversation and grow this community. It's time to be honest about the chat men have, or more accurately, don't have, about performance after 50. The cultural story is strong and discouraging. Things slow down, strength fades, and eventually, most men just accept it. Maybe you lean on a prescription as a quick solution when you need it most. That kind of acceptance is the biggest mistake a man can make. It's the surrender that crushes confidence long before biology has its say. I'm here to tell you that decline almost never hits like a sudden switch on your 50th birthday. It's a slow, creeping problem, a mechanical and circulatory bottleneck that builds over years of modern life. Your issue isn't an abrupt failure. It's a traffic jam at the most critical junction in your body. When a man notices a noticeable drop in erectile quality, consistency, or sensation, the underlying cause is usually a combination of 3 mechanical issues, all focused on the very spot we're about to work on. Grasping these 3 points is essential to understanding the true power of this 1-minute fix. Number 1. The vascular culprit. Arterial stagnation. Think of it as rusty plumbing. Biologically, an erection is about 90% blood flow. The penile tissue works like a sponge that needs to fill quickly with blood, delivered by the internal pudendal arteries. Over the years, modern diets, inflammation, high stress, and especially long hours of sitting cause the inner lining of these vessels, the endothelium, to stiffen. They become less flexible and less responsive. Practically speaking, when you sit a lot, gravity and pressure compress these vessels. Blood flow slows, causing stagnation. It's like rusty pipes. low pressure, and the system takes longer to get going. On an emotional level, this delay kills spontaneity. It takes longer to get ready, triggering anxiety that further tightens the vessels, creating a vicious cycle of performance panic. Number 2. The muscular culprit, the pelvic floor chokehold. Biologically, this is the chronic tension paradox. The pelvic floor muscles, or PFMs, form a diamond-shaped sling that controls everything below the waist. The modern man's paradox is that these muscles are often both tight and weak at the same time. They're constantly tense from stress, poor posture, and clenching, yet they lack the strength to work properly. Practically speaking, this ongoing tension physically squeezes the major blood vessels and nerves running through the pelvic region. It's literally cutting off the supply just as the signal arrives. Emotionally, this tension prevents your body from entering the rest and digest parasympathetic state, which is essential for sexual arousal. Simply put, you can't be stressed, tense, and fully erect at the same time. Number 3. The neurological culprit, faulty wiring. Biologically, it's the garbled signal. The pudendal nerve is the superhighway for sensation and the go signal for erectile tissue. This nerve passes right through the pelvic floor muscles. When those muscles are tight and overworked, they can pinch, compress, or irritate this vital nerve. Practically, think of a pinched nerve like faulty wiring. The signals get scrambled, slowed, or weakened. The result? Reduced sensation and delayed or incomplete physical response. Emotionally, a loss of sensitivity is often the first subtle sign of decline, but it hits confidence hard. You feel disconnected from your own body, making it harder to fully enjoy intimate moments. The bottom line? Your vitality isn't lost. It's trapped behind this mechanical bottleneck of stiff arteries, tight muscles, and compressed nerves. The spot we're about to target acts as a release valve for all 3 systems at once. I'm Dr. Ella, and for the past 12 years, my urology practice hasn't just focused on prescriptions. It's been about discovering foundational, holistic, and lasting ways for men to protect their total health: physical, sexual, and emotional. I've had thousands of men sit across from me, often frustrated and feeling alone, saying, "Doctor, I don't feel like myself anymore." They're fed up with quick fixes that never tackle the real problem. Here's my guiding philosophy. You are not a broken machine. You are an incredible system that just needs proper, consistent care. The decline you're experiencing isn't a mystery. It's an anatomical issue that calls for an anatomical solution. This massage technique isn't something I invented. It's ancient wisdom now backed by modern physiology. I recommend it to my patients not as a replacement for full medical care, but as a key part of daily preventative maintenance. It's about moving from passive dependency, waiting for problems and relying on a pill, to proactive control, using simple daily actions to stop problems before they start. It's 1 minute a day to protect decades of future comfort and confidence. We've covered the why, the mechanical bottlenecks of circulation, tension, and nerve compression. Now it's time for the how, the execution. But before I show you the exact spot and technique, we need to tackle the 5 biggest mistakes men make with self-care like this. Avoiding these errors is the difference between quitting after 3 days and seeing life-changing results in 3 weeks. Mistake number 1: aggression over finesse. The problem is treating this sensitive area like a deep tissue sports massage on a hamstring. Many men think more pressure means better results. Biologically, too much force can irritate the pudendal nerve and cause tiny injuries, making the inflammation and vascular blockage worse. Practically, if you're sore the next day, you've applied too much pressure. The right amount feels like the ripe tomato test. Firm enough to gently press into the tissue, but soft enough to be therapeutic and slightly tender. Never painful. Emotionally, pain causes avoidance. If the massage is uncomfortable, your brain sees it as punishment and you'll quit. Take it easy. Gentle, consistent practice always beats brute force. Mistake number 2: the dry rub. The error is skipping the oil or using the wrong kind, like sticky lotions. Biologically, oil isn't just a lubricant, it's an active therapeutic agent. Massaging dry tissue creates friction that prevents deep penetration needed to fix the underlying vascular issues. The right oils, such as castor oil, carry powerful anti-inflammatory compounds deep into the tissue. Practically, the goal is to glide, not scrub. Using the wrong product can undo the benefits of good oils. Think of the oil as half the prescription. Emotionally, a warm therapeutic oil turns the massage into a soothing ritual instead of a chore. It stimulates your sense of touch in a comforting way and helps lower stress hormones. Mistake number 3, the weekend warrior mindset. The error is inconsistency. Trying the massage for 3 or 4 days, noticing only small changes, and quitting because you didn't see instant results. Biologically, we're retraining decades of stagnant blood flow and chronically tight muscles. You don't get fit after one workout, and you can't clear a traffic jam in a single pass. It takes time for arterial walls to regain flexibility and for the nervous system to allow the pelvic floor muscles to fully relax. Practically, you'll notice small improvements in sensation within 7 to 10 days, and meaningful, measurable changes in consistency after 4 to 6 weeks. If you miss a day, don't double up. Just return to your 1-minute daily routine. Emotionally, this practice calls for patience and self-trust. When you stay consistent, the reward isn't just better function, it's the deep satisfaction of knowing your body is responding to your deliberate care. Mistake number 4, poor positioning and strain. The error is trying to do the massage while standing awkwardly or sitting in a way that cramps your hands or wrists. Biologically, if you're straining to reach the area, the very muscles you want to relax, the hip flexors and pelvic floor, end up tightening, working against the massage. You can't relax a system that's being strained. Practically, find a comfortable, stable position. I suggest lying on your back with knees bent and feet flat on the floor. This fully relaxes the hips and pelvic floor, giving you easy, deep access. Emotionally, awkward positioning leads to avoidance. If reaching is a struggle, 1 minute will feel like 5 and you'll give up. Make it simple, comfortable, and easy to repeat. Mistake number 5, focusing only on the event and creating anxiety. The error is doing the massage only right before an intimate moment, treating it as a pre-game necessity. Biologically and emotionally, when you tie the massage solely to performance, you instantly add pressure and expectation. This spike in anxiety activates the fight-or-flight sympathetic nervous system, releasing cortisol and adrenaline, strong vasoconstrictors, into your body. You end up working against your own chemistry. The solution? Treat this as daily maintenance for overall pelvic health, like brushing your teeth. Do it at a neutral time, such as after your shower before bed. The goal is to build a healthy, functional system 24/7, so your response becomes natural and effortless when the moment comes. Now that we've avoided the common pitfalls, let's get specific. Here's the complete protocol for turning 60 seconds of focused touch into deep systemic health. Part 1. Locating the command center, the perineum. This spot, known as the perineum, or in traditional healing, the Hui-Yin point, is the anatomical guide. It's a diamond-shaped area positioned exactly halfway between the base of your scrotum and the tip of your tailbone. Coccyx area. Focus on the central, soft, fleshy section right in the middle of the forward half. The tender clue. Gently explore the area. You'll notice a spot that feels slightly different, maybe a small, soft indent. When you apply moderate pressure, it will feel noticeably more tender than the surrounding tissue. This tenderness is a clear sign you found an area of chronic tension and blood flow stagnation. This is your target, the Y point. It's crucial because it sits directly above the core pelvic floor muscles and marks the junction where the internal pudendal artery dives deep into the pelvis to supply blood to the penile tissue. Part 2. Refining your 60-second technique. Once you're in a comfortable, relaxed position, lying down with knees bent is usually best, and your oil is warmed, follow this 1-minute sequence. Step 1. Application. 5 seconds. Use about a teaspoon of warm oil to cover the entire area. Let the warmth relax the skin. Step 2. The pressure check. 5 seconds. Place your index and middle fingers, or just the middle finger, on the spot and apply ripe tomato pressure. Firm but comfortable. Take a deep, slow breath. Step 3. The circular pump, 30 seconds. Using moderate pressure, make small, slow circles. Move clockwise for 15 seconds, imagining the motion flushing out stagnant blood and bringing fresh blood in. Then go counterclockwise for 15 seconds. Step 4. Press and hold decompression, 20 seconds. Switch to a press and release pattern. Apply firm pressure, hold for a slow count of 5, then fully release for a slow count of 5. Repeat 2 to 3 times. This sustained pressure is key for nerve release, decompressing trapped pudendal nerve branches and releasing tension in deep pelvic floor muscles at specific trigger points. Step 5. The deep breath finish, 5 seconds. Remove your fingers and take one final, slow, deep breath. Inhale into your belly and exhale completely. This reinforces the parasympathetic relaxation state. Part 3. The optimized oil protocol. The oil is more than just a lubricant. It's your therapeutic medium. I recommend starting with one of these 3 options to get the maximum benefits. Option A. Castor oil, the deep tissue penetrator. Why it works. Castor oil has over 80% ricinoleic acid, a powerful anti-inflammatory fatty acid that can reach deep fascial layers, easing the inflammation that causes stiff tissue and restricted blood flow. Practical advantage. It delivers a therapeutic depth that lighter oils can't match. Use a high-quality, cold-pressed, hexane-free organic castor oil. Option B. Black seed oil, the circulatory booster. Why it works. Black seed oil from Nigella sativa contains thymoquinone. Research links it to better blood flow, lower systemic inflammation, and modest support for natural function. Practical advantage. It's pricier, but many men report a stronger sense of internal warmth and rejuvenation. Option C. The enhanced carrier blend, the custom mix. Mix equal parts castor oil and coconut oil. This blend acts as a booster, combining the benefits of both oils for a smooth, therapeutic massage. Add 3 to 4 drops of high-quality rosemary essential oil per ounce of your carrier oil. Rosemary is a potent circulatory stimulant. Caution. Essential oils are very strong and must always be diluted. Never apply them directly to this sensitive area without a carrier oil. Gentlemen, I want you to step back and see this practice not just as a performance tool, but as an act of fundamental self-respect. The emotional impact of physical decline is huge. It's the constant, quiet fear of embarrassment, the avoidance of intimacy, the loss of that inner confidence that tells you you're still vital, still strong. By committing to this 1-minute daily routine, you're investing in your overall dignity. And the amazing part is, when you clear the central mechanical bottleneck in your pelvis, the benefits flow through every part of your life in ways that are both surprising and profound. Number 1. Reclaiming bladder control, practical relief. One of the most common things I hear is dramatic improvement in urinary function, less annoying post-void dribbling, and, more importantly, a big reduction in nocturia, those multiple trips to the bathroom at night. Emotionally, the freedom from worrying about leaks or interrupted sleep is huge. Number 2. Freedom from chronic lower body pain, physical liberation. Your pelvic floor is the anatomical core. When it's chronically tight, it pulls on the lower spine and hips. I've had patients whose long-term 5-year back pain vanished simply by releasing tension in the pelvis. Emotionally, this brings back physical freedom. the ability to stand, walk, and move without nagging stiffness. Number 3. Enhanced core strength and stability. Confidence in motion. When the pelvic floor is relaxed yet functional, your entire core works better. For men who golf, cycle, or lift weights, a healthy pelvic floor gives a stable foundation, reducing fatigue and improving performance. That 1 minute of massage is just the trigger. The real transformation is the comfort, freedom, and restored dignity you feel when your body starts working for you, not against you. Gentlemen, you're at a crossroads. You can accept the cultural myth that decline is inevitable, or you can choose the path of proactive control. You can dedicate just 1 focused minute a day to a simple, proven technique that improves circulation, eases deep tension, decompresses critical nerves, and supports your natural function from the inside out. We maintain our expensive cars. We service our home appliances. We wouldn't allow a traffic jam to persist at a crucial city intersection. So why wouldn't we give the same care and attention to the most complex, beautiful, and vital system we own, our own body? The investment is minimal. The payoff is huge. Restored function, better physical comfort, reduced anxiety, and the quiet, lasting confidence that comes from taking meaningful action to control your health. Here's my final challenge to you. Try this for 30 days. Commit to the 1-minute routine, morning or evening, using the right oil. Don't judge the results after just 3 days. See the difference after 30. Notice the subtle changes: better sleep, sharper sensation, less hip tension, and the quiet return of confidence. I promise, your best years don't have to be behind you. If this information struck a chord and gave you hope, hit the like button now to affirm your commitment to this journey. Subscribe to our channel, where I share practical, science-backed solutions every week. And most importantly, drop a comment below. Share the one change you've already noticed from taking a more proactive approach to your health. Your story could inspire another man still struggling in silence. Take command, gentlemen. You deserve the comfort, freedom, and confidence that comes from a body functioning at its best. I'll see you in the next one.